My name is Alejandra Armesto. I work at the German hospital in Buenos Aires, Argentina. I'm in charge of the pediatric ophthalmology department there. It seems that the population in Asia, particularly in well-developed parts of Asia, like in urban China and Singapore and Japan, highly or more high educated people are getting more myopic due to environmental factors, not only to genetic factors, because they increased the rates of myopia in the last years, and we cannot attribute that to genetic factors. So it seems that they're spending less time outdoors, doing activities like sports, and they are spending a lot of time indoors reading and doing near work with their vision. This seems to stimulate the elongation of the eyeball because it's related to the levels of dopamine, that is a neurotransmitter that seems to stimulate the sclera to grow and to have a larger eyeball than expected. There are many initiatives in relation to the treatment of this problem because in these countries it turns to be a public health problem, very important public health problem. Not only because people will need more optic devices like contact lenses or glasses or refractive surgery, but because they are getting highly myopic, and high myopia is associated to another kinds of diseases like myopic maculopathy and retinal detachment and stuff like that. We have to really stimulate the children to be outdoors. There are some works, some papers that studied this aspect. For example, in China, in Guangzhou, they selected some children from different schools, and they obliged some of them to be like 40 minutes a day outdoors with natural sunlight. And they found statistically significant differences between the group of people, of children who were outdoors and people who were not outdoors. There were less myopia incidence or rate among the children that were outdoors, only with 40 minutes more. But that's not the recommendation. The recommendation is to be much more time outdoors and to stimulate parents to be with the children outdoors doing any kind of activity. Near work seems to be another factor that could be reduced by reducing the use of cell phones and tablets and computers, but that not seems to be so important as natural light. Well, it's been years since many groups try to develop an eye drop in order to treat myopia and in order to arrest the growth of the eyeball, because a larger eyeball is a more myopic eyeball. So they started with atropine. This was like many years ago, many decades ago, but some very good papers were done in Singapore about this subject. The problem with atropine that it had many side effects. They tried with another drug called pirenzepine, that it was not that effective, and they returned to atropine. And nowadays we are prescribing atropine 0.01% once a day for 6 to 7 days a week to children age 6 to 13, 15, 17 years old, in order to arrest as much as possible the growth of the eyeball.